Hey, I'm Dr. Shimer, and I'm here to talk with you today about how to effectively debrief. So really my goal is to give you just some practical hands-on pearls for how to run an effective debriefing with your learners so that they take away the most from the experience. So I'm currently an associate professor with University of Louisville, work out in Western Kentucky where I've started a simulation program here to work with our transport program and with our staff in the hospital. So as we're moving forward through this, my goal is that you'll understand the importance of psychological safety to adult learning in simulations, that you'll be able to discuss the successful parts of debriefing, and know the techniques for addressing knowledge gaps. So the first thing we're going to talk about is the importance of psychological safety in adult learning in simulations. This is critically important. If you remember back to basic physiology and they talked about the parasympathetic versus the sympathetic nervous system, you'll remember that when you have anxiety or fear, it triggers that sympathetic nervous system and it gets charged up. When somebody has that charged up, you've triggered that fight or flight mechanism, and it makes it more difficult for them to access their logical part of their brain to think through things logically and to problem solve. And so it's really important that when you start in simulations that you are aware of creating a situation, an atmosphere that's psychologically safe for learners so that they can take the most away from it. And in fact, there's lots of research that points out to the importance of this, of creating that psychologically safe environment. So Chang and Epic actually published in 2019, and they reviewed all the research that looked at this and basically said there's wide agreement that exists about the importance of a supportive learning environment as a prerequisite for successful simulation-based education and debriefing. So when we're talking about that, how do we really look at it? Well, if we understand where learners tend to get hung up, then we can really devise it to address those issues for them. So actually, Jenny Rudolph and compatriots published in 2014, really looking at how to create that safe environment. And they defined that there were 4 ways that learning can be impeded by adult learners during a simulation. And the one is that the learners don't buy into the simulation endeavor. And so this is where it doesn't seem real, that it's not actually real, and so they have difficulty immersing themselves into it and participating in the simulation, and they really need to immerse themselves to get the most out of it. They also find that the fidelity of the simulation is problematic. The breath sounds don't sound like real breath sounds, and finding it decreased on one side versus the other can be difficult for them. They will feel exposed by the simulation. These are people who, boy, their goal when they come to work, they came to healthcare, they want to be healthcare providers because they want to help people, and they bring everything to this, and they want to take the best care of their patients. And so now you're asking them to come into a simulation environment where it's gonna, their work is going to be under a microscope, and that itself may affect how they perform, and it'll make it more difficult for them to learn because now that professional identity of theirs, because it's under a microscope, they may feel threatened by that. So how do we alleviate that? And then they feel defensive. So they're gonna fall short at some point during the simulation on the standard of providing that care for these patients. And now you'll have to talk about it and bring that up with them. And they're gonna feel defensive in that. That's gonna trigger that anxiety. It's gonna trigger that sympathetic nervous system. So how do we go about doing this to alleviate those things? So Rudolph went on to talk about there are 4 practices that help us establish a psychologically safe context. So one is really clarify those expectations for them. Let them know that this is meant to really just help refine their skills and give them pearls, and what those expectations are in the process. Help them establish that fiction contract. We're here. We know it's not a realistic environment. We're trying to create it as best we can, but you will have to suspend that disbelief and that really immerse yourself in the simulation to get the most out of it. Make sure that you attend to logistical details. What if they have to go to the bathroom? Those little things can bother people. Or what if they have to take a page or a phone call in the middle of the simulation? How do they deal with that? And then the next thing, and this is really key and important, is really make sure that you get them to understand that you are committed to respecting your learners and that you have a concern for their psychological safety, and make sure that they understand that as you're moving forward. So again, learners take psychological risks. They are presenting themselves. They are going to be vulnerable in the middle of the simulation, and they're going to learn best when they're in non-threatening situations. So when we're not firing that sympathetic nervous system, we're not getting that triggered, we're not hijacking our logical thinking part of our brain. So non-threatening situations is how adult learners learn best. So again, you want to help them to think about their hands-on experience in simulation with the goal of you're just looking to gain pearls and refine techniques so that you can provide more effective care with your next patient. Because what we do in simulation, the goal is that it will change what happens in the real world next. And then if we do that, we're going to succeed in real life. And we're going to affect the morbidity and mortality for babies and mothers throughout Tennessee, which is awesome. So now, how do we do that? Introduction is our key opportunity. That's where we're going to set the atmosphere for our learning. We're going to address those initial concerns that they have. We're going to engage learners in our vision for providing excellent care for every baby and every mother in Tennessee, and how we're going to change infant morbidity, maternal morbidity, infant and maternal mortality throughout Tennessee. So introduction is our key opportunity. This is where we're going to set the atmosphere for learning with our patients. We're going to deal with the question of why are we changing how we do education here? We're instituting simulation. So you're going to deal with that, address that, so that you're setting that atmosphere for learning. You're going to engage them in our vision. This is how we're going to decrease infant and maternal morbidity and mortality throughout Tennessee and provide more effective care for them. We're going to link it, by providing that vision, we're going to link it into their heart. So we're going to get their buy-in, and they're going to want to be more invested in this process. And then we're going to understand that we're going to help them understand that the simulation's role is to support healthcare providers' performance. So this is something that the literature has shown over the years, that when you run simulations, even the best learner retains it for about 8 weeks, and that's it. And yet NRP is 2 years between recertification. Well, we're now addressing that, and NRP is now saying, hey, let's go back. We really recommend skills, quarterly skills, that we revisit these so we can kind of fine-tune these skills, because in some of your hospitals, they're really small hospitals, and you may not have to give positive pressure or chest compressions very often. And so it may be a couple of months before you use these skills. And so really helping them understand that the goal of this is to help support healthcare providers so that they can provide the best care possible for their babies and their mothers, because all babies and mothers everywhere should receive the same excellent care no matter where they're delivered, be it a tiny rural hospital with no labor and delivery services or a thriving academic mecca. As we move forward with this, let's discuss the parts of a successful debriefing. We've talked about psychological safety, why it's so important. Now, how does that feed in with how we're doing our different parts of a successful debriefing? So let's talk about the basics of simulation debriefing. Remember that your learning objectives, they drive the simulation. They are your roadmap. So when you're running a simulation and you're learning how to debrief for the first time, you're going to find that you get pulled off on tangents and you lose track of where you are in your learning objectives. Do them in a sequential manner, the sequence in which the simulation was run, and go back to your learning objectives. They're your roadmap. They'll bring you back. Just go back to them. Now, remember that learners learn best when they're actively involved, not when they're passive. Sometimes new debriefers will look at the information and they'll teach more than they will actually debriefing. And so try not to do that. Passive learners, spoon-fed learners will not retain the information as well as if they've figured it out for themselves, if they have become active. So pull the information, don't push the facts. Ask the questions, and then remember that when you've asked a question, they have to process the question and then they have to think of the answer. There will be silence. Don't fill the silence. Wait for it. Give them a chance to come up with that answer. And then always look to identify and relieve learner anxiety. If it's there, if you see it, figure out why and try to diffuse it for them. So one of the situations that we see it is novice learners may feel uncomfortable correcting a more experienced learner. So one of the ways you can get around that and kind of empower them to offer up answers and empower them to participate and to build their confidence in their performance is to start with the least experienced person first when you ask a question, and then move to the more experienced person. And in that way, you can empower their participation and build their confidence. Another way is positive reinforcement is really important too. B.F. Skinner talked about this back in the 1960s, how important positive reinforcement was for humans and for their learning. The thing that can happen if you don't reinforce what they've done well is they may walk away and not be sure that it was the right thing. And so then they may not do it the next time. So you really want to reinforce them, confirm that what they've done is correct, confirm their knowledge, and that by doing that, what you will do is ensure that they continue to do that. Yeah, that was the right thing to do. You're also building your rapport and trust in them, because you're not just out to find all the things they do wrong, but you're out to really support them and acknowledge what they're doing really well. The next thing, and this is really critically important, is to identify and fill those knowledge gaps. Those are where they don't perform the skill right or they give you the wrong answer. You really want to correct those in this process, because what you don't want them to do is take the wrong information away and then start teaching that to other people. And so what you'll have is a ripple effect that gives you a deterioration of skill sets rather than improvement in skill sets. So the first place we're going to start is with the introduction, and that's how we set the scene for this. We're going to start general, and we're going to work towards details that are needed for the simulation. And so the first thing you're going to do, and you have to address, is get rid of their anxiety so that they can focus on the information that they need to run the simulation and then actually running the simulation. So you start out with your introduction. Hey, this is who I am, so everybody knows who everybody is. Introduce yourself, have them introduce themselves, what they do, where they work, and then you're going to move towards, because this is a new thing you're doing in your hospital, is provide them with a vision. Why are we doing this? This isn't we're going to go and penalize people for doing skills wrong. This is we're participating in a TIPQC. This is a Tennessee-wide, and our goal is to improve mortality and morbidity for mothers and their babies. And this is the vision. Get their heart involved, diffuse any concern they might have about there's something punitive related to this. No, this is really, we're just looking to make care excellent throughout Tennessee. And so now the heart is linked in. Now the next concern they're going to have is somebody's going to go talk about it behind my back if I make a mistake. So make sure they understand that what happens in simulation stays in simulation. Just like Vegas, what happens in Vegas stays in Vegas. That confidentially should be maintained. Nobody should be talking about this outside of the simulation room. And that if they hear somebody talking about it, they need to let you or some other person in leadership know so that that can be addressed and that can be stopped. The other thing is, now that you've diffused some of these common things that create anxiety for them, move into telling them how they can get the most out of this. You've got them to buy in, you've diffused their anxiety for why we're doing this new thing. Now help them to find out how to make the most out of this experience. So treat it as a real simulation, suspend disbelief, and really immerse yourself in it. Wear the gloves you would wear, use the equipment that you would use. If you don't have something, ask for it. The next thing, give them a time frame so they know what to expect. This simulation is going to take an hour. We're going to spend 5-10 minutes orienting. Don't chintz on the orientation part. Really spell these things out for them, because it's going to make everything run a lot smoother. Spend the time, 5 to 10 minutes on the orientation. Then talk with them, tell them it'll be 2 to 3 minutes we run a simulation. Then we're going to go debrief it for 10-15. Then we're going to run it again, and then debrief again. And then we're going to run it a third and final time and debrief a final time, so that they're not surprised. You want to avoid any surprises with them. Next, orient them to the mannequin. This is my mannequin. This is what it can do. This is what you can do to the mannequin. This is how you're going to get your vital signs. This is how you're going to get your information, so that they know how to work best with that mannequin. And then if you have a Confederate who's helping out, introduce that Confederate. Let them know what role they're playing and what information they can get from the Confederate. And then finally, now that they know how all the pieces are working, you can give them the scenario and start the scenario. So now you're running the scenario. For this kind of a situation, I really like the rapid cycle deliberate practice. There are a couple of advantages that this gives us when we're talking about simulation. One is that as new debriefers, you can stop them after a couple of mistakes. You'll see if you ran the whole simulation, you would become overwhelmed with all the little mistakes that might happen and have trouble going back. So it's an advantage for you to stop after a couple of mistakes and then debrief that. And then the next advantage is for the learner themselves. Now you're going to take them back, restart the simulation at the beginning, and now they're going to be able to immediately practice hands-on those skills you just talked about. So now you're going to get muscle memory into it. And the key to this is when you run a simulation and you do it just once and you debrief it, at some of your hospitals it's really small. They may not have, but it may be a couple of months before they're actually in an environment where they would use chest compressions or have to give positive pressure ventilation. So this, they can reinforce it immediately. The other thing is you're covering a lot of learning objectives. And so if you break them up and give them a break with the debriefing and then going back and rerunning that simulation, then you're going to help them refocus. They're getting hands-on learning, you're breaking it up, they're going to be more likely to focus on what you're doing. So now we run the scenario. So now where do we stop it? So usually I tell my new debriefers, stop it after 3 errors and then go ahead and debrief it. Or with yours, it's a little bit longer. You may want to run it to the completion of 1/3 of the learning objectives and then stop the simulation. At this point in time, learners will have run that simulation. They're going to be emotionally charged. They just ran it, their heart rate's going to be up. Help them diffuse that. They've triggered their sympathetic nervous system. So now help them diffuse that so they can access more easily the logic part of their brain and lay down the memories and learn. So the first thing you're going to do is ask them to take a physical step away from the mannequin, from the warmer, from the mother, and let's talk about this simulation. And then, because they're still going to have emotions, you need to allow them to diffuse those emotions. So the first question you're going to ask is, so how did that make you feel? This allows them to acknowledge that stress. Wow, yeah, my heart rate's up. This was really scary. And then you're going to validate their feelings and say, yeah, it is. It's really scary to be in this kind of a situation. Or, yeah, this really does get our heart rate up. And it's really nice that we can be in an environment that's really safe and just work through these and refine our skill sets. So let them know, yeah, it is. Now, there will be a learner at some point who will complain about the difference between the simulation and real life performance. So what is at the core of that is they have a fear. They know they didn't perform like they would in real life. And maybe that's because they have a knowledge gap, or maybe it's because the simulation threw them off. And so there's a fear there. Diffuse it, don't ignore it. Here's a simple way to diffuse it and go through it. Acknowledge the unrealness of the simulation and its effect on the performance. Yeah, you know what? It isn't like real life, and that does throw us off. It is a little bit different, and I understand that. We know that. And then what you want to do is appreciate their patience. I really thank you for having patience with us and working through this. And then refocus them. But I would really encourage you to suspend that disbelief, because I can't replicate real life here. So just suspend that disbelief with the goal of improving our care in babies in the future. And that will diffuse that every time. So now we've diffused the emotions. So the next thing we want to do is capture the golden nuggets. So this is where we allow them to debrief themselves. There are going to be things that are just right at the tip of their tongue, right on their head. You want to take advantage of that, because that'll cement better in their memory. So the first thing you want us to do is start with the positive things, the things that they did well. What did you do well? The advantage of this is now you're building trust, you're building rapport with your learners, because you're not looking for all the negatives, you're looking for what they did well, and now they can build on successes. So it diffuses that anxiety again. So what do you think you did well? Validate their observations. Yes, you did that well. And then explore it further. So why did we do that? And how did we do that? And so now you're actually debriefing one of the objectives, and they've told you which one to do first. And so that's very powerful, getting that stuck in their brain, for wiring that in their brain, cementing it there, and then you'll be able to move in and say, okay, so what do you think you might improve next time? And so now that they've had this positive experience, they'll be more likely to take a risk and tell you what might need to be improved. And then ask them, why do you think that? What might have worked better? And If they ask a clarifying question, then help them discover the answer. So now you've gone through, you've debriefed a couple of the learning objectives, but not all of them. We've captured those gold nuggets. So now go back to the beginning and debrief the remaining learning objectives in the sequential order of the simulation event so that you keep yourself on your roadmap. Do the ones you haven't done yet in order. And then for each one of those learning objectives, what you're going to cover is, what did you do? Why did you do it? And how did you do it? And then at the end, you're going to summarize that learning objective by restating the question. So what were the 3 signs of effective positive pressure ventilation? And then that's, again, through repetition, you're going to get them to revisit it again and cement it in their memory better. So now how do you transition from one learning objective to the next? So you're going to say something like, you did these interventions. Did your baby respond? What did you do next? And so now they're going to tell you what next, and that'll lead you to the next objective. So again, rapid cycle, deliberate practice. So you're going to stop once you get to 1/3 of the learning objectives completed with the simulation. You're going to debrief those, and then what you're going to have them do is go back and run the scenario again from the beginning. Again, that gets them to apply what you've just debriefed hands-on, so you're being very active with your learners. Then you're going to run that scenario to complete about 2/3 of the learning objective. You're going to stop it, debrief that second third of the learning objectives, and then go back and run it again from the beginning. So now they get to apply it again and run it to completion, and then you're going to debrief the final third of the learning objectives. So now we've gotten through all the learning objectives, and now you're at the end of the simulation. So how do you summarize the total simulation? And this you're going to tailor to really what are the key learning points that you want to emphasize based on your current learners' skills, because you'll have different skill sets with your learners. And so you really want to ask questions that reinforce those key learning points, so that you're asking the question, what were the 3 signs of effective positive? What was Mr. Sopa? When do you start chest compressions? So you're asking them the question, and they are giving you the answer. You're making them active in this process, and it'll cement those key learning points. Then give them an opportunity to ask questions. They will have questions, and they'll be ready to be vulnerable with you because you've established that trust, that you can be trusted. And so that gives them an opportunity to ask questions. They'll be wonderful questions. Always reinforce with positive reinforcement. That's a wonderful question. I'm so glad you asked that. That's a really interesting question. That's a great question. And then help them explore what the answer is by taking them back to the basic physiology science and help them find and discover the answer. At the end, you want to wrap it up. So what will you take home? And the best way to do this is, what's one thing you'll take home from this simulation, or that you want to share with someone else? You want every person to answer that question. So ask that question of every learner and have each one of them give you an answer, and try to start with the least experienced person first and move towards the more experienced person. This will really, that'll be that final nugget, that thing that really stands out for them, and it'll reinforce that learning moment. Avoid using the word learned. What did you learn? When you ask somebody what they learned, then they have to admit they didn't know. And for some learners, this will put them on the defensive. They won't want to show any vulnerability. And so what you'll get is, well, this just reinforced everything I knew. And so you don't get a take-home point. So avoid that word learn so you don't get them on the defensive. So we've talked about the parts of a successful briefing. So now the other key to debriefing, and this is probably one of those hardest skills to learn, is how do you address knowledge gaps? How do I identify the knowledge gaps and then address them? Because it's critically important that we do that, right? And a lot of novice debriefers, they say, I don't want to embarrass them. I don't want to make them feel stupid in front of others. And I had this same issue when I first started, and Dr. Byrne was training me, and I had a pediatrician who wanted to give a D10 bolus, 10 milliliters per kilo for a volume bolus, and I didn't correct her because I was afraid I was going to embarrass her in front of her nurses and respiratory therapists in this simulation. And Dr. Byrne was like, no, you can't do that, because if you do that, every person in that room now thinks that a D10 bolus at 10 milliliters per kilo as a volume bolus is what you should be doing. And if somebody else tries to correct them, they're going to say, no, 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 we were in that sim, it was D10. And so now you're going to have a deterioration of skill sets. So you have to identify them and you have to correct them so that when they walk away, they're going to share that information with other people and it's actually going to improve people. So you're going to get this ripple effect for better rather than for worse. So now how do you identify those knowledge gaps? Really, you need to be a content expert. That's critically important. So what is a content expert? That's somebody who knows what is recommended, they know why it's recommended and they understand why it's recommended, and they know how to perform all of the skills correctly even in difficult circumstances, and they understand what those complications are that could result from performing them. And that's critically important. So now there are two main types of knowledge gaps that will reveal themselves. One is performance. That's your skills base, that's your hands-on, okay, they didn't perform positive pressure ventilation effectively. And this can be due to the simulation environment, to the mannequin, or it can be due to a lack of knowledge. It doesn't matter why it happened, you're going to treat them with the same approach. Walk them through it hands-on. Take them back to the bedside and have them walk through it. The other type of knowledge gap is going to be an actual knowledge where they have an inaccurate fact or the wrong answer to the question. And so what you want to do is use questions to make them think their way through to discovering the right answer. Because again, you're not spoon feeding them and making them passive, you're making them active. Find the why for what we do and figure out, think it through so that they come to that answer on their own. They'll remember it much better that way. So, okay, performance gap. So this is you're observing poor performance on a skill-based, hands-on technique. They're performing positive pressure ventilation, but there's actually no change in the pressure on when you're watching them do it because they're not doing it well. So in the debriefing, you've covered, with your learning objectives, you've covered what are the signs of effective positive pressure ventilation or whatever the skill is. This is the signs that you're doing it well, okay? And then you've covered why it's so important, right? 99.9% of babies will respond to positive pressure ventilation, effective positive pressure ventilation, which means only 1 out of 1,000 babies needs chest compressions. That's like, woo, I only have to do this 1 out of 1,000 times if I know how to do positive pressure ventilation effectively. So then what you're going to do now that they understand why it's so important is bring them back and have them perform that skill right there at the bedside. All right, so since this is so important, why don't we all come back to the bedside and why don't you go ahead and bag my baby for me? And then you walk them through doing it properly. You're going to compare it to the challenges of a real life simulation because a mannequin, that mouth is perpetually open, and we all know that a real baby we're giving positive pressure ventilation to is hypotonic and floppy, and so that mouth closes all the time. So now talk about what are the real life challenges and how that's different from a mannequin and what pearls or techniques for how they can make it be more effective on a real baby. And so you're going to give each learner a chance to perform those skills so they each get that hands-on reinforcement. Now, for a knowledge gap where they've given you the inaccurate fact or the wrong answer to the question, what you're going to do is break it down to a basic physiologic level that everyone knows and then build them back to discovering the correct answer. So if you're running through Mr. SOPA and they say the O is oxygen, take them back to the basic physiologic level. Okay, so which is easier to breathe through, a coffee straw or a snorkel? Everybody knows that answer. It's a snorkel. Now, why is it easier? Well, because it's a bigger airway and it's less airway resistance. So how, when you're giving positive pressure to this baby, can you ensure that you've decreased airway resistance to the best of your ability so that you can be more effective with your positive pressure ventilation? Oh, yeah, I would keep that mouth open and I would make sure I'm in sniffing position so that my trachea is as wide open as it can be. So you're building them back so that they discover the correct answer and making them an active learner. Remember that 85% of communication is nonverbal, and so you want to be very aware of what you're doing. It's not what we say, it's how we say it. What's our tone of voice? Why did you do that? Versus, why did you do that? It's a very different question. It conveys a very different idea for your learner. One is going to make them defensive, and the other one's going to make them go, I want to share with you why I did it that way. And then you understand what their thinking behind it is. So Be aware of your tone of voice. Make sure you're in control of it. Body language too. If you're crossing your arms, then they're going to know that you're not as open to what's going on. So be open with your body language as well as your facial expressions. If they do something that's really wrong, don't go, ooh. They're going to respond to that. It's going to throw them completely. They're going to be totally thrown by that. So be very aware of your facial expressions. Make sure they're always encouraging, that you're smiling and you're working them through this information. So how do you help learners remember? Really, this is about repetition, and we've gone through this, everything as I've taken you through. It's all about repeating, repeating, repeating. Repetition is a great way to do it. The next way is making them an active learner, not a passive learner, so that they discover the why answers. You're going to pull the information with questions. Don't push those facts on them. And then you're going to watch for learner anxiety and diffuse it, because if they're having anxiety, they're triggering the sympathetic nervous system. That's a fight or flight response, and that makes it very difficult to access your logical part of your brain and lay down memories. So it's important to watch for that learner anxiety and diffuse it every chance you get. And then compare what you're doing in the simulation to real life scenarios. We all know that if we're just reading in the book about different things, we don't remember it as well as if we have a case and then we go home and read about that case. So you want to compare it to real life situations. Okay, we're doing this skill here. How's it different on a real baby? How's it different on a real mother? What kind of challenges can you be faced with? And what's a good way to fix that and to change what you're doing in order to compensate for that? The next thing is the simulation location. Do it in their delivery room. Do it where they're going to be doing this procedure, this skill, because then they're using their own equipment. It's in their own environment. They know where everything is. They're learning where everything is. And so you're getting all of those pooling in to create better memories for them. The last thing is cognitive tools. I love cognitive tools. I have them up in every delivery room on our pandas for our babies. It'll have what our goal oxygen saturations are for the minute. We have one for Mr. SOPA, because if they're in the minute and they've got to give positive pressure ventilation, their heart rate's up, sympathetic, they may forget, oh yeah, increase the pressure. I forgot that part of Mr. SOPA. So it's real easy for them to glance at it and look at it and refresh themselves. Now, debriefing is a very difficult skill to learn. It takes time. So how can you help yourselves refine your debriefing skills? So the first thing is DASH, is a debriefing assessment for simulation in healthcare. This is a validated tool. It's in your handbook. You've got the handbook for it. You have the score sheet for it. So use this with each other and give each other feedback so that you can keep working on your own skill sets. It's an excellent tool for that. Then debrief each other and practice simulations. You can work amongst yourselves and pretend that you're the learner and walk through that simulation and see how things work. And then you can address, what were the challenges to it? How do you think you could address them next time? And then practice those ideas amongst yourself to refine them. If you're working with real learners or in amongst yourselves and you find something that works really well, take notes on it after you finish the simulation so that you can look at it later and cement it in your head. And then brainstorm what didn't work with fellow debriefers. I use this myself. If I've got something and I've got a learner, gee, that didn't work out well, and then I talk amongst my other debriefers, how could I have done this better? And then we come up with a way to handle it, and then we refine it for the next time. So remember, while debriefing is a hard skill to learn, it is worth it. You will make a difference, not only in your own hospital, but across Tennessee for the health and the morbidity and mortality of mothers and babies throughout Tennessee. And remember that what you do in simulation, it will change what happens in the real world next. And if we do that, we succeed in real life. I have at the end of the lecture, there's a reference and reading list. These are really great articles. Please go find them, read them, and they'll really give you more information about what's going on. And then at the end of the lecture, I just have some NRP, the Neonatal Resuscitation Program. I have examples of how to actually word filling in knowledge and performance gaps for you guys to look at. So I just want to thank you very much for being here today, and hope this has helped you understand some of the practical pearls for effectively debriefing. If you have any questions or need anything, please feel free to contact me, and you guys have a wonderful day. Good luck simulating.